Ending the tobacco use epidemic and the death and disability it causes requires a multifaceted approach involving statewide tobacco control programs that are comprehensive, sustained, and accountable. Oregon's Tobacco Prevention and Education Program, or TPEP, was funded in 1996 by a ballot measure that raised the tax on cigarettes and dedicated 10% to tobacco prevention and education. TPEP funds support cutting-edge, proven strategies to identify and stop tobacco-related disparities, eliminate secondhand smoke exposure, prevent youth tobacco use, and help smokers quit. Addressing disparities is a priority that is woven throughout our tobacco prevention and education goals. Oregon's Tobacco Prevention and Education Program implements strategies in each of the listed program areas noted on this slide: monitoring and tracking tobacco use and policies, environmental strategies to protect people from exposure and access to tobacco, support for people who want to quit, awareness and education messages that warn of the dangers of tobacco, minimizing exposure of tobacco advertising and promotion, and importantly, maintaining a sustainable and evidence-based tobacco prevention and education program. Examples of activities that fall under the Tobacco Prevention and Education Program components include collecting information about cigarette consumption, providing basic quit support services through the Quit Line, coordinating a paid and earned media campaign, and funding communities to engage partners and leaders at the local level to make sure the places where Oregonians live, work, play, and learn provide options for tobacco-free living. Monitoring tobacco use across the population is a critical program component. It is from this that we can identify opportunities to assure all people in Oregon can live tobacco-free. Despite significant progress in reducing tobacco prevalence, disparities remain. Oregon adults who are struggling to get by because they have lower incomes or haven't finished high school are 3 to 4 times more likely to smoke than Oregonians with higher income and educational attainment. Not surprisingly, the same general trend is seen when looking at health insurance. Those who are on Medicaid are twice as likely to smoke as those who have any other type of health insurance. And the cost to Medicaid for tobacco-related disease and disability in Oregon each year is $374 million. Not demonstrated on this slide, but important to share, is that 26% of people who report experiencing any periods of poor mental health in the past month are smokers, versus 16% of people who did not experience any periods of poor mental health. And among people with serious mental illness or addiction, smoking rates are even higher. The good news is that across the population, most people who smoke or use tobacco want to quit. Adults with mental illness attempt to quit smoking at rates similar to others, but are less successful.